Hello, everyone. Thank you for joining us today. We'll get started in just a couple minutes. Please give me a thumbs up if you can hear me all right. Awesome. Yes, Sandra, I think you're unable to unmute yourself. Do you have a question? Shall I? I'll allow your mic if you have a question. Oh, yes, perfect. Thank you. Alrighty. So yeah, we'll get started in just a couple minutes. We'll let people come in and join us. Are you able to hear me now? Perfect. Awesome. I just muted myself for a second. Thank you, Stephanie. Please feel free to go ahead and place your name, your organization, role, and if you feel comfortable, contact information, like email in the chat so we can all get to know each other a little bit better. And maybe as a fun icebreaker, your weekend plans. If anyone's going to the beach or a concert.
So good afternoon, everyone. So we get started. You wanted to wait a little bit more, Safa?
I think we'll wait just a couple more minutes. I am letting more people in. They're coming in hot, so just so they don't miss anything. Maybe like one more minute and we can get started.
A small tune starts dancing in my head. Not too fast, just a step ahead. Like a word I never said, but it smiles instead. Oh, it feels kind of new.
So maybe you should get started.
Yes, let's go ahead and get started.
All right. Thank you so much, Safa. Good afternoon, everyone, and welcome. Thank you for joining today's City of Hope Tobacco Cessation Learning Collaborative Training. So today's topic is the hidden impact of tobacco on cancer, diabetes, and also environment. And the City of Hope Tobacco Cessation Learning Collaborative is supported by LA County. And then our goal is to strengthen tobacco cessation through education, provider training, partnership that reduce tobacco-related health disparity, and together with a lot of our collaborators, volunteers, and local community partners, we wanted to advocate for smoke-free environments that protect people from secondhand smoke, also help denormalize smoking, support those who wanted to quit. And we're very grateful that like many clinicians, navigators, community partners, advocates are here today so we are all committed to healthier, smoke-free environments. So like Safa just shared some of the housekeeping rule. If you just arrived, please type your name, your title, your email, organization that you're representing in the chat box for our meeting record. And please note that this meeting will be recorded. If you don't like to have your image recorded, please stay off the video, or you can turn off the video. If you have any questions or comments, please feel free to put it in the chat box, and we'll address it as many as we can. And also, we will have dedicated time, breakout section for sharing, and please use your microphone button to mute or unmute yourself. And of course, like we have our evaluation at the end, and please feel free to scan the QR code and help us to provide a brief evaluation to help improve our sections. So as always, like we have some ice breaking is like to share some of the awareness month and key messages with every one of you every month. June is the National Cancer Awareness Month. A reminder that like quitting tobacco remains to be one of the most powerful steps for cancer survivors to take for healing and for long-term health. And so nearly 1 in 10 cancer survivors still smoke light years after diagnosis. As we can see here in City of Hope, many of the cancer survivors, cancer patients, they're still struggling with tobacco use. And we can see higher rates among bladder cancer, lung cancer, ovarian cancer survivors. So like very important, even though like for very brief conversation, we talk about 5 A's, we talk about AAR in our previous meetings, just a brief conversation about tobacco use, advising the patients to quit smoking, to quit tobacco use, and connect them, navigate them to free tobacco cessation support services that can help improve the treatment outcomes, lower the future cancer risks, and then help to support healthier lives for the survivors and the families. So June is National Men's Health Awareness Month. Emphasize that men are significantly more likely to use tobacco than women. So and they are more likely to use cigars, smokeless tobacco, and e-cigarettes. So it's very important to encourage men to access free tobacco cessation services and other preventive care to improve their overall health. And of course, like June, we celebrate and honor Father's Day. And then it's a very important time to remind and encourage our fathers, grandfathers, brothers, caregivers in our community to take care of their health. And to stop tobacco use is one of the most meaningful steps that they can take, not only for themselves, but for their loved ones who relied on them and then to count on them. June is Pride Month, and this is a month to celebrate LGBTQ plus communities and recognize ongoing health disparities. Tobacco companies have long targeted LGBTQ plus space through advertising in bars, events, publications, and which contribute to higher tobacco use. So, like today, you can see here the lesbian, gay, and bisexual adults report higher smoking rates than heterosexual adults. And they're more likely to use an e-cigarette as well. And among the youth, LGBTQ plus youth are nearly twice as likely to smoke because of the trauma and the stress and the discrimination sometimes faced, and also the stigma. And there are over 30% reported tobacco use. So as providers and community partners, we can all help together to counter this problem by offering inclusive, affirming, and accessible tobacco cessation support and trauma-informed cessation support. This is a busy month. June is also PTSD, the Post-Traumatic Stress Disorder Awareness Month. So it's a time to recognize how trauma, stress, culture, and community connections can shape health behaviors, including tobacco and nicotine use. So we need to have a prevention first, trauma-informed approach to help tobacco cessation and to help reduce cancer, heart disease, respiratory illness, diabetes, complications, and other health risks for the patients. And we need to address the disparities of the exposure, targeted marketing, and also we need to have culturally responsive quick support for this community to promote healing and reduce harm. Of course, we don't forget Juneteenth. And then, so we honor freedom, resilience, and the ongoing work towards health equity. And this year is super important and special because it's the 250, and it's also a reminder to address the lasting impact of tobacco-related disparities in the Black communities and to connect people with the respectful, accessible support to stop tobacco use. And in June, we also recognized the Earth Day. We wanted to remind that like tobacco harms not only affect our health, also our environment. From toxic cigarette waste to pollution that can affect the community we serve. So we always share these slides because many factors like where we live, how we access to care, education, community support that can shape our health. Tobacco use and quitting also like influenced by some of these similar conditions. So some of the communities face greater exposure to tobacco and fewer resources to stop tobacco use. So that's why making prevention support even more important. And we need to focus more on equity, improve access to culturally relevant and responsive tobacco cessation programs, and strengthen the community connections. So we hope that we can reduce tobacco use and lower the risk of the chronic health disease. So I wanted to take the opportunity to share a little bit about the 2026 Asian American Cancer and Diabetes Health Symposium last month. And this is hosted by American Cancer Society City of Hope and Lions Club International District for L2. And so we focus on cancer and diabetes. We cover different topics, including cancer health advancements and tobacco prevention control. So this event is free to public. It's an annual event. We live stream it through YouTube in 6 languages, English, Mandarin, Korean, Vietnamese, Japanese, and Hindi. And here are the topics that we cover on the day, including the topic that we're going to cover to recap today is the hidden impact on of tobacco. So we are very, very grateful to our symposium collaborators, community partners, of the sponsors, vendors, and also a lot of volunteers to help to create this accessible multilingual event, very successful to connect the families and the community. So the symposium goal is to bring families together, community leaders, health experts together to share the trusted information, build stronger support network, and offer practical tools for cancer and diabetes prevention and care. So Asian American communities can take actions for healthier cancer-free and tobacco-free lives across generations. So the symposium, we have reached about 500, over 500 people, and including online audience and in-person attendees. There's a lot of volunteers to help this symposium successful. And like here, we podcasted in 6 languages, and then we reached about 342, and it's going up because like we depend on also all of you to help us to share this to other people, and so more people can get the benefit from this symposium. And here are some of the pictures we want to share with everyone about the symposium. Here are the speakers, the vendors, and everybody, including a lot of volunteers and the committee members. And the 2027 interest survey is also open, and then we welcome you if you would like to collaborate or like join us for the next symposium meeting. And then please feel free to scan a QR code and or email us, and then we'll include you in the committee. So now we wanted to move to the today's topic, the hidden impact of tobacco, cancer, diabetes, and environment. And then we have a really wonderful event on the last month. We wanted to share with every one of you, and then we have a deep dive discussion today. So I will pass on to Safa and also our speaker, Joseph and Safa. Safa, are you?
Hi, are you guys able to hear me now?
Yes.
Oh, perfect. Yes, so I will serve as the panel moderator, and a little bit about myself. I work as a project coordinator at City of Hope C-Care program, and specifically within the tobacco cessation program. I earned a bachelor's degree in biopsychology, which is essentially known as behavioral neuroscience from University of California at Santa Barbara. Now I'm pursuing my MPH degree concentrating in biostats and epidemiology at USC. And my passion for tobacco prevention and even cannabis education really started when I was young. My dad he was a smoker, and now he vapes, and it's almost ironic with the work that I do. And just seeing him have a very hard time kind of kicking that habit, it made me very passionate about this work, and it made me realize that I have a purpose in this field to hopefully stop other people from picking up this bad habit, but also recognizing the risks involved in it and how predatory the big tobacco industry can be, especially amongst youth and marginalized communities. I did an internship at Santa Barbara County Public Health Department's tobacco prevention and cannabis education program, and then I was hired full-time to continue my work. But since then, I have moved down to kind of this Southern California region, so LA County and Orange County, and that's where I started at City of Hope as a project coordinator. So yeah, I'm very happy in my role. And now I'd like to introduce Joseph Hayden, who also works at City of Hope. I'll actually allow Joseph to maybe give a little bit of his background information.
Sure, Safa. I actually didn't know that about you, but it's very interesting. My family loss, I think you're going to show the slides, is exactly what motivated me to become activated. I do work at City of Hope. I actually work in IT as a disaster recovery program manager. But because I work for such a wonderful place that includes a smoking cessation program, it happens to parallel my personal life where I have been a tobacco volunteer slash activist for, gosh, a couple decades now. When I was in law school in the 1990s, I was one of the crazy people that kept on, complaining about the tobacco industry and started publishing some articles in our law school newspaper. And everyone said, oh, you're not going to make any progress. And I know we have made a lot of progress, but there's still so much work to be done. So a number of years ago here in the Bay Area, I got reactivated to be very involved with some of the California progress on tobacco retail licenses, smoke-free multi-unit housing. And it has been very helpful to see that we're on the right side of history, and hopefully we'll make a huge impact, because there's still way too many people needlessly dying from the most preventable cause of death. So that's basically why I'm here. And I have been very active in almost every Bay Area county in some way or another, trying to help pass ordinances. I go to Sacramento to do lobbying. I do whatever I can as a volunteer. And meeting Sophia and your team has been just a great inspiration, since I can get involved in this way.
Awesome. Thank you so much, Joseph. And just to clarify, Joseph and Safi, they will be our guest speakers, where they'll be sharing their expertise, both their personal and professional expertise on their work in tobacco prevention and education. So yes, Joseph is one of our guest speakers. And now for Safi, I'll allow you to introduce yourself. Yes. Are you able to unmute yourself, Safi? Interesting. On my end, it looks like you do have both camera and mic privileges. Let me try one more time. Okay. Are you able to unmute yourself now? Okay, no worries. Maybe I'll introduce Safi while she comes back in. So Safi is a CAH PE3 program coordinator at Appeal for Health, which is also known as Asian Pacific Partners for Empowerment, Advocacy, and Leadership. And in this role, she supports national efforts to advance tobacco prevention and cancer control within the Asian American, Native Hawaiian, and Pacific Islander demographic and communities. Safi is a native Mandarin speaker with roots in a lot of cross-cultural communication, and she brings a very passionate and deeply community-centered approach to her public health work. She obtained her Master's of Public Health and Global Epidemiology from Emory University and their Rollins School of Public Health, and she also earned her Bachelor's of Science in Cognitive and Behavioral Neuroscience from UC San Diego. Her expertise spans not only from research and community program development, but also a lot of data-driven health communications across multiple different industries and fields, so in nonprofit as well as international settings. She is greatly motivated and driven to or for community health work. And yeah, we're so excited to have her as she has so much knowledge and tools and resources to lead a healthier and tobacco-free lives, especially amongst like diverse communities. So yeah, we're so happy to have both Joseph and Safi serve as our guest speakers today. So now we'll commence to their presentations. It'll be a recorded presentation just in the interest of time. And then after the presentations, I'll moderate a discussion amongst Safi and Joseph, and everyone else will also be able to ask questions to them.
I'll be introducing Safa Muhammad. Safa Muhammad is the project coordinator at the City of Hope's Tobacco Cessation program.
I'm going to move forward.
Yeah. Perfect. Thank you. I was just about to suggest that.
Joseph, are you able to see the screen and unmute yourself?
Yes, thank you, everyone. Good afternoon. I am Joseph Hayden. I'm honored to be invited here by my amazing co-worker, Sophia Young. I've been attending her meetings for years now at work. And I learned very early on that marginalized communities were of little value to big tobacco. In the early 1990s, when I was still a law student, I started writing articles in the law school newsletter or newspaper about the insidious industry and was told, you can't fight a tidal wave. Well, I wasn't alone, and that often meant, and that doesn't mean that we should remain silent. Health equity has been a very important element of my activism. I got this diagram here from the Truth Initiative, which is a great source. Anytime I observe demographic health inequity, my conclusion is that it's due to tobacco industry targeting tactics. I've always thought globally about this issue whenever advocates would make some inroads into tobacco control here in the United States, the industry would just move on to its next target. This was exemplified one time, which I distinctly remember shortly after the United States banned big tobacco from sponsoring events like the Virginia Slims tennis tournament, which I protested at. The industry just picked up where it left off by sponsoring music events throughout Asia to addict new populations and acquire fresh victims, I mean customers. Okay, thank you for moving to the next slide. This is some about, oh no, go ahead, if you can go back, please. This are some of my speaking engagements on tobacco. I like to say that my biggest credential is being a loudmouth about this subject. I was on a panel at the second annual Endgame Summit last summer in Chicago that was hosted by Action on Smoking and Health. I gave a continuing education presentation at City of Hope on campus for the Pride Health Symposium a year ago. Last week at the Board of Supervisors in San Francisco, I advocated for smoke-free bar patios, which has been in the news a lot here. I also regularly speak at City Council and environment justice forums about tobacco retail licenses and smoke-free multi-unit housing, especially here in the Bay Area. Okay, please go to the next slide. Lest anyone think that I have something against people who smoke, the whole reason I got into this was because I lost close loved ones much too soon to their tobacco addiction. These are all my family members who died very young. In particular, I want to point out my cousin who died at age 35 from osteosarcoma, which he developed in his pelvis. He traveled much of the last 6 years of his life. He was diagnosed at 29 and tried a lot of experimental treatments in various countries to no avail, unfortunately. And of course, there's me with my father who died at 50 from his years of suffering from his tobacco addiction. And unfortunately, his own mother died at the same age at 50. So that's a family tradition I definitely don't want to continue. Next slide, please. Every tobacco activist I find has a curmudgeon who approaches us with an anecdote like, but my grandmother smoked every day until she was in her 90s. So this is my response to that. You can also survive by putting on a blindfold and running across the freeway, but why would one? All right, next slide, please. So I coined the phrase peddlers pushing poison because I really think it's important to call tobacco, commercial tobacco, what it is. I like the alliteration, but the statistics here are what really drive me crazy and keep me up at night. So we're in California, where 40,000 of our fellow Californians die of tobacco-related illness every single year, 480,000 Americans, and 8 million people globally, because 20% of the world is addicted to tobacco, unfortunately. Next slide, please. So the racist quotes on this slide are almost too difficult for me to read out loud. If you can't read the text there, it says, Big Tobacco decided Asian Americans were a profitable target due to their, quote, genetic predisposition to smoking. I don't even know what the hell that means. And the other graphic here is an important quote that was part of an expose many years ago from a model who was in these ads, quoting an RJR executive who said, we don't smoke that shit, we just sell it. We reserve the right to smoke for the young, the poor, the black, and the stupid. Next slide, please. So cigarette filters are made of non-biodegradable plastic, and they are the most littered item on earth. I asked many of the youth who may not have experience with tobacco-related illness in their families to get engaged for the environmental reasons also. So despite a little progress that we have made, we still have a very long way to go. Next slide, please. I like to point out also the true costs of smoking. The tobacco industry was up in arms when prices, minimum price per pack was set, but a $10 price pack is nothing compared to what it really costs our society, which is much closer to $40 a pack. And every Californian, regardless of whether they smoke or not, pays $487 a year for the cost it is to our society. And the tobacco industry does spend a lot of money, $500 million a year, excuse me, just in California, where smoking has actually gone down tremendously to try to get their deadly products sold. Next slide, please. Another thing that keeps me up at night is that many of us have retirement plans and investments in what are called diversified funds. But what I try to point out is that diversified funds very often include tobacco stock. So since we come to work every day fighting tobacco and diabetes, I think it's important that we make sure that our retirement funds aren't putting 1 cent into these industries. So it's not always easy to do, and not everyone has financial literacy to do it. But I think that our retirement plans in particular, should be based on sustainable funds, and that we should have the option to do that very easily. So I encourage everyone to think about that, because as you can see here, the American Medical Association, American Lung Association, and other companies that fight cancer all the time had to do a about face and make sure that their own retirement plans weren't inadvertently investing in this industry. Next slide, please. So I'm glad I'm not the first person to talk about RFK Jr. today, but these are difficult times. The White House Chief of Staff is actually a current tobacco industry lobbyist. Reynolds just made a huge contribution to Ballroom this past week, and they got an invitation to Mar-a-Lago, and they're actively trying to influence the administration to ease up on flavored vapes, which end up unfortunately being very attractive to the youth. And the youth is a demographic that tobacco industry is looking to addict. I don't know if you're able, Safa, to play the video there, but This is a video of RFK Jr. During a congressional hearing. He's actually popping a nicotine pouch into his mouth on live TV, trying to be discreet. And he puts it in his cheek. And there's plenty of evidence that he is buying them because he's been photographed outside of stores carrying the Zyn packages, and he has actually recently started endorsing nicotine pouches. Next slide, please. So I am constantly upset at the product placement of these combustible cigarettes. And in particular, the one on the right bothers me. The original avatar had Sigourney Weaver playing a medical doctor in the exam room, by the way, on a spaceship hundreds of years in the future, smoking a cigarette. What could possibly go wrong? And even more recently, this Netflix series called Three Body Problem had all these PhD students in London. This is a modern era. It did take place in the 1940s, but you'll notice that the protagonists are all smoking. They linger on the protagonists' beautiful faces. None of them ever cough. And when the director of this series was asked why he had all of the smoking going on the screen, he said he couldn't figure out what the actors would do with their hands. To which I respond, maybe he needs to go back to directing school, and the same thing goes for James Cameron and his Avatar. Next slide, please. So, as Sophia and I have discussed numerous times, vaping devices are not a smoking cessation device. Despite what the current administration might want to push, the FDA has never approved an e-cigarette. And the problem with these devices are that they may have started off with lower amounts of nicotine, but now, of course, they can. The customers were demanding, more, and unfortunately, the industry was willing to provide. So, one vape device can have the equivalent of 400 cigarettes. All right, next slide, please.
Wow, thank you so
much. Oh, that
much.
is it. Yeah, thank you for letting me fire hose you with all this information. Thank you.
Thank you again, Joseph. That was such a wonderful. That was a wonderfully passionate presentation, and we look forward to hearing more about your experience shortly during our panel. I will move on to Safi. She is joining us from Atlanta, Georgia, virtually. And if you'd like to continue or commence your presentation, that would be wonderful.
Good afternoon, everyone. I'm Safi. I'm the CAPE Program Coordinator at APPEAL, the Asian Pacific Partners for Empowerment, Advocacy, and Leadership. I'm joining you virtually from Atlanta, Georgia. I think it's truly an honor to be here with you today. Next slide, please. APPEAL is a national organization advancing health for Asian American, Native Hawaiian, and Pacific Islander communities. I coordinate CAPE program, one of 9 CDC-funded national networks supported by the CDC Division of Cancer Prevention and Control, which is focused on commercial tobacco prevention and cancer control across all 50 states and 6 U.S. associated Pacific Island territories. Everything we do is community-rooted, and that community lens is exactly what I want to bring our topic today. Next slide, please. Thank you. When people hear tobacco and Asian Americans, they often assume the risk is low, but the hidden impact tells a very different story. Tobacco is a known driver of cancer, lung cancer, throat cancer, and more. But what is less known is its connection to diabetes. Smoking worsens insulin resistance, damages blood vessels, and makes diabetes harder to control and treat. For our communities where both cancer and diabetes rates are rising, tobacco is quietly making both conditions worse. And the danger does not stop with the person who smokes. Asian American teens are 15% less likely to discuss tobacco with a healthcare professional, meaning that secondhand exposure within families and homes goes underaddressed, silently affecting children, elders, and everyone in between. Next slide, please. This hidden impact is not happening by chance. The tobacco industry has deliberately targeted Asian American communities, sponsoring cultural festivals, advertising in Asian languages, placing more tobacco ads, and fewer health warnings in our neighborhoods. Today, that same predatory playbook is being used for vaping, with flavored products and social media campaigns aimed directly at our youth. The environment our community lives in, the billboards, the stores, the digital spaces, is saturated with tobacco messaging. That is an environmental impact too, and we cannot just ignore it. Next slide, please. Vaping is the newest and perhaps the most, the previous one. Thank you. Vaping is the newest and perhaps most hidden face of this crisis. It is sleek, flavored, falsely perceived as safe. We got all of the flavors out there. We got mango, blueberry, and menthol. And just this month, I believe that the FDA approved new flavored vaping products, making them more accessible than ever. I think the science is clear because vaping causes nicotine addiction, high blood pressure, asthma, lung, and heart disease, all of which compound existing cancer and diabetes risks. And with today's financial pressures, housing instability, and epidemic stress, our youth are turning to nicotine as a coping mechanism before they even understand the consequences. Next slide, please. I wanted to share something personal because community always starts with lived experience. My uncle, who grew up in China, has smoked for most of his life. And like so many in our communities, nobody around him ever questioned it. Tobacco was simply part of the daily life, a gesture of socializing, of hospitality of being an adult man in Chinese culture. Years later, he developed lung disease. And even then, the conversation in our family was not easy to have. We did not want to cause shame. We did not want to point fingers. That is what saving face looks like in practice, and that silence has a real cost. Research confirms that what my family lived. Studies show that in many Asian communities, tobacco use is deeply normalized through cultural tradition, gender expectations, and social bonding, making it far harder to recognize as a health risk until the damage is already done. And when the person affected is someone you love, you understand why community-based conversations, not just clinical warnings, are the only thing that can truly change their behavior. This is not a failure of our communities. It is a call for our communities to lead the change. Next slide, please. And that is precisely what community-based work is for. At Appeal, we believe the most powerful intervention against tobacco's hidden impact is not a clinical program alone. It is a trusted community member who likes you, speaks your language, and understands the cultural silences that allow tobacco to hide. We train community health workers and trusted messengers to bring this conversation into cultural gatherings, faith communities, and family spaces, because that is where hearts and minds actually change. When communities are informed, connected, and supported, they become the most powerful force to prevention. Next slide, please. So what exactly do we do together? We name the hidden impact on cancer, on diabetes, on our environment, on our families. We create safe spaces for community to talk openly about tobacco without the shame. We train trusted messengers from within our own communities. We engage youth to gently reach their parents and grandparents, maybe in culturally respectable ways. And we demand accountability. Big tobacco earns $500 billion a year. Those tax dollars must come back to our communities, funding multilingual cessation programs and lung cancer screening accessible to all. Because tobacco impact is hidden, but our community power is not. Thank you.
Thank you so much, Safi. You put that so wonderfully, and thank you so much for sharing your expertise. We will now transition towards the panel discussion. I first want to open up questions to the audience. Do you guys have any questions for either Joseph or Safi about tobacco cessation, lung cancer screening, tobacco prevention?
Awesome. Yes, Sophia, maybe we can go ahead and pause the recording and I'll take
your question or your don't smoke. Yes, 100%. Don't consume tobacco products in general. Alrighty, but no worries. I have some questions to ask our panelists. And so first I'll start with Big Tobacco makes $500 billion in revenue every single year. And oftentimes they employ pretty predatory tactics, especially with the marginalized and vulnerable communities. And that keeps people hooked on their products. When people are ready to quit, they're met with many challenges. How do you think we should hold the tobacco industry responsible for education, community outreach, cessation, and lung cancer screenings and treatment caused by tobacco usage?
Well, unfortunately, some of the tactics they've used have been to develop so-called safer products like vapes, and so I don't know if we can ever trust them to manage it themselves. I think the programs that have worked best are the ones that take the settlement funds and have it directed by the states. Unfortunately, right now, with the Office of Smoking and Health being completely wiped out by the current administration, a lot of states that don't have the smoking cessation resources within their own governmental, within their state governments, basically have no cessation funds right now. California, of course, has been a leader. I tell people in California, you're already paying for smoking cessation. If you go to the California Kick It site, you can get texts and you can get support on the phone. You can get emails. Any way that you want the support to quit, it's already being paid for by California taxpayers. So fortunately, we do have that here.
Yes, that is perfect. Thank you so much for that response. And I'm sure it resonated with a lot of our
Sophia,
audience members and maybe their feelings. Safi, do you have anything to add?
Yes, I would like to touch a little bit from our side as appeal. I think the question you ask is really good because I think that statistic alone says everything. $500 billion in revenue built significantly on addiction, and the communities in this room and the families we serve are part of that equation. They are the ones who got cooked, who got sick, and who are now navigating lung cancer screening, cessation programs, and treatment, often without enough support. So how do we kind of hold them accountable? I think first through policy, we need legislation that requires tobacco and vaping companies to contribute directly to public health funds, specifically designated for prevention, education, and community outreach and cessation programs. I think tobacco settlement funds has existed since 1990s, but the question is whether these dollars were actually reaching the communities that needs them most, including Asian American, Native Hawaiian, and Pacific Islander communities were too often left out of the mainstream funding streams, right? Secondly, I think through transparency, these companies must publicly disclose how they're marketing their products, who they are actually targeting, and which communities are being most exposed. Because for right now, much of that marketing is happening quietly, I would say, on social media through influencers in language other than English, reaching our communities without accountability. Third, I think through community power. When communities are educated, well-organized, and vocal, they become the most powerful force for accountability. And very informed, connected community is one of the industry cannot just ignore. And that is where organizations like Appeal come in. We kind of help communities understand their rights, their risks, and their voice. I believe lung cancer screening and cessation support must be fully funded and made accessible to everyone, regardless of language, insurance, and immigration status. If the industry's products cause the harm, the industry must help fund the healing.
Thank you so much. That was a wonderful response. And I believe with both what Joseph and Safi said is how important policy is. Remember to vote. Remember to really dive into what local policies affect you guys, as well as statewide and even federally and nationally. Education is everything, and there's a lot of information out there. So we encourage you to understand what can affect you through policy and vote in your health and your community's health best interest. And I will ask one final question. In many Asian cultures, topics like cancer and smoking can be sensitive. What cultural factors like stigma or saving face most affect decisions about quitting or addressing tobacco exposure?
I don't mind just saying one quick thing that I've learned over the years is that perhaps one of the most respectful ways of addressing it is letting people who smoke know that it is others around them that they are harming. Because sometimes if you just say, you should quit for your own health so that you can live a long life is not enough. It's when their loved ones are affected. I know I grew up in a household where I got constant ear infections, and voila, it's because my father was a chimney and we didn't have the wherewithal to speak to him about it. And after many years of smoking in our faces, he realized that it was harming us. And I think is much more effective than just haranguing him the way I did and begging him to quit for his own health.
Yeah, absolutely. It has a very personal impact for a lot of people, not only in this room, I'm sure, but also in our communities. And Safi, did you want to mention anything else?
Yeah, I want to thank you first for this question because it's so close to my heart. I believe that in many Asian American communities, tobacco use has been normalized for generations. It is social, it is polite, it is what the men in the family do after dinner. And because of that deep normalization, bringing it up feels like an accusation, like to the person itself. Nobody wants to kind of shame a family member, right? Nobody wants to disrupt the harmony of the household. That is kind of saving face in practice. And what happens as a result, people often stay quiet, silent. It might be a grandmother, breathes in secondhand smoke every evening and says, oh, it's nothing. Or it might be a teenager watches their father smoke and thinks this must be acceptable. I think that is why the silence become inherited. So what we need to do is gently reframe the conversation. Instead of just pointing fingers, we invite families to protect each other. Instead of calling tobacco a personal failure, we call it a community health issue that deserves a community response. I think when trusted messengers from within our own communities, people who understand these cultural dynamics from the inside are the ones who can open these doors in ways that clinical programs simply just cannot.
Awesome. Thank you so much. And I feel like the moral of this tobacco panel is to meet smoking and vaping as well as other tobacco consumption with compassion and understanding. Empathy goes a long way, but also understanding that there are evidence-based solutions out there. There are effective ways to quit tobacco products. So there is hope in stopping. Thank you so much to our panelists, Joseph Hayden and Safi Zhu.
Thank you so much for the amazing panelists. So now we're going to turn back to our live audience today. And then we have some of the questions from the audience. And I think like Dr. Kamali, right? Like earlier.
Dr. Damani, yes, I saw you had raised your hand earlier, and we'd like to give you the floor to ask Joseph and Safi your question. Oh, yes. Images.
All right, so.
Now you're able to unmute.
Okay, thank you, guys. This is really a lot of information. It's quite overwhelming, especially since the vaping has become so prevalent in young people who, as you said, are under the impression that it's the safer or safe version of smoking. Have you guys found in your experience, either working with the Asian community or what seems to be the most effective when it comes to engaging younger people to try to make that change or to stop vaping? What have you guys found?
Safia, you haven't been able to speak yet. Are you able to speak yet?
Yeah.
You want to go first?
You can go first.
Okay. I will say that the thing that there's actually a couple of things with the youth. A lot of the youth don't understand the mortality. If you extrapolate how much they will spend in their lifetime and you give them that number, that usually scares them. There are also, I think a lot of youth that I have worked with are less likely, I think I may have mentioned this in my slides, less likely to have direct family members that they've witnessed suffer from tobacco-related illness. So when they hear about the statistics on the environmental damage, and I would say that while vapes are a scourge, be on the lookout for these nicotine pouches that are wrapped in plastic. There are YouTube challenges to have our youth put as many in their mouth as possible. It's horrifying to think. And then they discard them, and they're being found all over campuses all the time. So not only are they non-recyclable plastic, but they're putting them in their mouths, and dentists are finding that youth in their 20s are getting receding gums from the use of these nicotine pouches. So this is a very real problem, and unfortunately, our health and human services secretary is not only a user but an endorser of these products.
I would like to add a little bit on that. From what we have seen through Appeal and CAPE, which is the programs that works best with youth, are the ones that do not treat young people just as an audience. They treat them as leaders. I think one of the most effective approaches we have seen is peer-to-peer education. When a young person hears about tobacco prevention from another young person of their own age, someone who understands their world, their social pressures, their social media feeds, it lands completely differently than just hearing from an adult or a health professional just telling them. I believe that young people they trust each other in a way that not outside program can replicate. So, youth ambassador and fellowship programs have also been incredibly powerful in our sites. At at Appeal, our national leadership work invests in training young people from AA and HBI communities to become advocates in their own right, not just participants, but actual voices for change in their communities and eventually in policy spaces too. When young people see themselves as part of the solution, I believe their engagement completely transforms. We have also seen that connecting tobacco prevention to things young people already care about works really well too. Social media campaigns that are created by youth, which are for youth, like art and storytelling projects, and school-based programs that are connected tobacco to real-life issues like stress, mental health, and financial pressure, because those are the real reasons like young people are picking up vapes in their first place. And honestly, any program that involves family alongside youth tends to be more effective in our communities, because in Asian American families, young people are often the bridge between generations. When we give them the tools and the language to have these conversations at home with their parents and grandparents, which in a culturally respectful way, the impact goes so much deeper than any classroom lessons alone.
Yeah, and
Okay, thank you.
I would even add to that when I present or I go to do media, I like to put the youth out front because no one wants to see a face like mine lecturing youth on how to behave. So it's really important, and I remind these youth that when they speak at city council and other in front of other electeds, they're changing their future, and they have much more, in the future invested in making these changes. So it's very inspiring to see.
Okay, thank you. That's very helpful.
Yes, absolutely. I think also acknowledging the real-time risks to using tobacco for teenagers or for youth is so important. Like Safi was saying, the long-term effects they may not care about right now, but if you tell them that it's going to make it really hard for them to run the mile for their next soccer tournament, or their skin may look a little bit more wrinkly, we have to meet youth where they're at in their understanding. I think as you get more knowledge and we get older, it's easier for us to truly understand the detriments of tobacco usage. But we have to put ourselves in the shoes of a 16-year-old or a 17-year-old, and also what social pressures they are facing in their current environment. And youth programs, youth ambassador programs are perfect for alleviating some of that pressure, some of that stress, because when you have a mass amount of people feeling the same way or believing the same thing, then you don't feel so isolated. If everyone is saying, yeah, tobacco's not great, then, or like all the youth are saying, yeah, I want to stay away from vaping, then you don't feel so alone. And so, yeah, so thank you so much for all of your responses. Does anybody else have any more questions? Yes, Dr. Kamani, absolutely. I've seen other youth. The moment you tell them their skin is going to look a little weird, they they get very nervous very fast. Versus telling them that, oh, they may get like cardiovascular disease in 10 years. They're not thinking that far ahead. Hmm. But yes, I wanted to open up the space to ask questions from any other audience members. And if not, I can move on to the next question. Sandra, that is a good question. I think right now it's hard for us to say, but there are grant funding options available kind of simply with a Google search. However, with the time we're in, a lot of grants are losing money, or grants that existed in the past, they have been put on pause and hold. So yeah, it's kind of hard to say.
There is a grant program that the State Attorney General here in California is providing. I'm actually working with several cities. If they are in flight with a tobacco retail license, they can acquire. A couple of the cities in the Bay Area here have acquired almost $1 million in funding for tobacco enforcement in terms of selling to youth and prevention of that. So you can certainly look into that. Rob Banta, the Attorney General here in the state of California.
Awesome. Thank you so much, Joseph. I actually did not know that, and that very good information to know. On a personal note, I actually used to manage the tobacco retail license program for Santa Barbara County, and I am very familiar with that grant, but yeah, I didn't know if it was still existing, just kind of with everything changing. But yes, thank you for the update. And now,
I wanted to share one thing is about the TRDRP, the Tobacco Research Grant and Tobacco-Related Disease Research Program. They have the opportunity in July. So starting July, they have a community-facing research opportunity, grant opportunity available. So you can look into it if you're interested or you wanted to partner with City of Hope, with any of our researchers here, please feel free to reach out to us. I'm gonna to put the link in the chat box. And I pull out our meeting evaluation. Like right now it's 3:02, so we wanted to move to the breakout section. We wanted to ask you to help us. If you can all take out your phone to help us to complete this meeting evaluation, that will be very helpful for us to improve our, let me see if I can pull up the evaluation form, the link posted in the chat. And then that will help us to improve the program. And then I wanted to share this multimedia contest with everyone before we move to the breakout sections. So this is an annual multimedia contest. We are collaborating with the Youth Cancer Health Ambassador Program, American Cancer Society, Lions Club, and then the Flying Heights Foundation. And this year we have a new partner, KYCC. And so please, if you know any youth, you have running a youth program, and then we encourage any elementary, middle, high schools and college students to join us. And then there are different cancer health related topics, tobacco prevention topic, and vaping prevention topic that like the youth can apply, and then they can do different types of media to submit, and then that deadline is August 31st, the end of the summer. And I hope that like they can earn some prizes, earn volunteer hours, and so hope that like we can showcase their work. And please help us to pass the words. And then so now I'm going to open the room so we have some of the time for breakout room discussion. So please like join the room that you're interested. We're going to have 2 different rooms. And let us know if you have any type of technical difficulty joining the room.
Yes. So one room will be dedicated to discussing cultural aspects in regards to today's presentation for the American Indian, Alaska Native, Native Hawaiian, Pacific Islander population, and the other group is the Asian American population. So please, we encourage you to join the group you'd like to learn more about.